Memorial's transparency program really, it gives the consumer of healthcare the opportunity to make informed, educated decisions. Why we want to do this is because we're all going to be patients someday. We have an obligation to this community to provide safe healthcare.
Most of us would not buy a car or even a toaster without looking at Consumer Reports or some other nationally acceptable means of comparative data. That's absolutely, it's even more true in healthcare. I wouldn't want to go get a heart operation if I didn't know my doctor did enough of those procedures, had a good rating with those procedures, and had good survival rates, and that I was going to be managed in a hospital environment that was safe and provided patient-centered care.
We want to be a value provider of healthcare services. What I mean by that is, we don't want to be the lowest cost provider, nor do we want to be the highest cost provider that gives you concierge service. We want to give you value for your money. Both the insurance company, the federal government, the state government, all payers of healthcare, and the individual consumer. We want you to know that for the money you have to spend out of pocket, you're going to get this quality and this service, and you're going to be able to look at our website and see how we do in terms of our safety metrics, our quality metrics, our service metrics.
The three parameters that I think are critically important for consumers to be looking at certainly is the quality of care that one gets, and that's measured in a variety of different ways depending on the particular procedure or service that will be provided. Secondly, certainly the cost of what that procedure or service will be. And third, the satisfaction or service levels that are provided by the organization in performing either that particular procedure or service for patients. Information presented to the public should always be presented in a fashion that's educative, so that it's not just 2 stars or 5 stars, but what does it all mean?
There has to be a commitment all the way through the organization that you have to embrace a culture of putting the patient first.
Transparency always mattered. I think healthcare historically was a very paternalistic profession, and it approached the care of patients from the standpoint of father knows best or the doctor knows best. And it was always important for consumers, for patients, for families to know and understand what is the treatment, what are the alternatives, what are the different outcomes related to different treatment modalities, and how does one doctor and one hospital compare to another? Because we all deserve to know that which we're getting.
Honestly, the consumer is going to drive this program. They're going to determine whether it succeeds or not, how they use it.